everyone joining us today, and thank you for tuning in. I am Dr. Al-Khalaf, a research fellow here at the University of Ottawa Heart Institute, and I am back as your host for this episode of BEaTS Research Radio, a YouTube channel and podcast produced by the Bioengineering and Therapeutic Solution Lab at the U Ottawa Heart Institute. Our goal at BEaTS Research Radio is to communicate science to the community. Our guest today is Dr. Jennifer Reed. Dr. Reed is a scientist in the Division of Cardiac Prevention and Rehabilitation, and Director of the Exercise Physiology and Cardiovascular Health Laboratory at the University of Ottawa Heart Institute. She's an assistant professor in the School of Epidemiology and Public Health in the Faculty of Medicine, and adjunct professor in the School of Human Kinetics in the Faculty of Health Sciences at the University of Ottawa. Dr. Reed's overall research program focuses on the role of exercise in cardiovascular disease prevention and rehab, as well as women's health. Thank you so much for joining us today, Dr. Reed.
Thank you so much for inviting me. It's a pleasure to be finally on the BEaTS Radio. I should say an honor, really.
Absolutely, the honor is ours. To start, I always ask our guests for a quick reflection on what shaped and directed them into choosing the field of science they operate in. Dr. Reed, what was your inspiration and motivation to enter the exercise physiology and cardiovascular health research?
There are probably two elements to my inspiration and motivation. The first, from an exercise physiology perspective, I can remember as young as a teenager in high school being fascinated by physical activity, anatomy, and physiology, that I decided to pursue an undergraduate degree in kinesiology and health studies at Queen's University in Kingston. I think this is likely a fairly common path for adolescents, young adults who are athletes and are interested in science and how it relates to training and performance. And this certainly was the case for me as a competitive swimmer. For the cardiovascular piece, I think that's a bit more of an interesting story from my perspective. So I actually began my doctoral studies at the University of Toronto and then was recruited by Penn State University. And I pursued doctoral studies in clinical exercise physiology and women's health, specifically reproductive and metabolic health. And during my second year of studies, I was approached to be a teaching assistant for a world-renowned exercise physiologist who is actually a former astronaut. So a bit scary of an invite, but one I couldn't, say no to. So I began being the TA for this exercise physiology course, and I was just so enthralled by my discussions with this professor, Dr. James Powelzik, that I found out he taught another course specifically focused on cardiovascular regulation. So I used to sneak out of lab in the daytime, which was, a bit of a no-no because I'm there for studies focused on exercise and women's health. I used to sneak off to these cardiovascular lectures. And he gave me my first Rowell textbook. And I was so fascinated by the cardiovascular system that when there was a posting at the Heart Institute, I thought the position for a fellow within the Division of Prevention and Rehabilitation was a perfect fit because it combined clinical exercise physiology, women's health, and also cardiovascular expertise and interests. So here I am today with a focus on exercise physiology and cardiovascular health.
Yeah, and this is definitely one of the most vital areas of research and areas of care when it comes to the overall cardiovascular health field. And we'll get into that a little bit here. So delving into the science, what are some of the newest findings that highlight the importance of exercise science within the overall research efforts directed toward cardiovascular health and treatment?
Ooh, that is a good question. We could be here all day discussing science and findings that I find particularly interesting. But if I was to drill down to one specific area for the sake of time, I would focus on the exercise training and atrial fibrillation literature, an area that I spend quite a bit of time working in. If you look across CVD populations, those who've had a recent event, are at moderate to high risk of cardiovascular disease, or had a recent procedure, you would be referred to cardiovascular rehabilitation. And that applies to our CAD populations, heart failure, across the board. But if you are an individual with atrial fibrillation you likely seek treatment frequently at a cardiovascular health center, but you're not referred to cardiac rehabilitation. In fact, when you look at Canadian and international clinical guidelines, there's no recommendation for lifestyle or specifically physical activity as part of the clinical management for patients with AF. So I found that really intriguing. And so a few years ago, there was a landmark paper published in Circulation by Malmo and colleagues. They're located in Norway. And they demonstrated in patients with non-permanent atrial fibrillation that 12 weeks of aerobic interval training, 3 sessions a week for approximately 3 months, led to substantial, both clinical and significant reductions in time in AF. And they also observed greater improvements in VO2 peak, ejection fraction, quality of life, and there was a trend for reduced admissions and cardioversion procedures in the group that performed aerobic interval training 3 times a week for a month, when compared to a control group that was asked to simply maintain their regular physical activity habits. So I found that fascinating, and it actually aligns with some currently funded trials I have through CIHR and Heart and Stroke, looking at exercise training strategies in patients with AF. But here's a group of patients that are in need of better treatment options. They demonstrate low exercise tolerance, poor quality of life and mental health, and present with all the traditional risk factors. But they're not recommended physical activity or lifestyle interventions despite all other CVD populations being recommended. But they truly are a population that we really must study, and study in terms of what is the impact of physical activity in these patients, because there's large potential for them to derive substantial cardiovascular health benefits with simple practical tools such as physical activity.
Yeah, physical activity as medicine and as a rehab is definitely something that if we can expand more of it and if we can accumulate more of that into the literature, then for sure it will have benefits. Now, I want to ask you a question for the uninitiated. What is the difference between regular cardio and interval training?
Yeah. So interval training is typically described as short bursts of high intensity activity. So you could think of it as running on the spot for 30 seconds at a high intensity. And by doing that repeatedly for approximately 15 to 30 minutes, that would constitute a bout of high intensity interval training. The other really practical way to think of it is telephone pole exercise. So if you can imagine telephone poles in your neighborhood, and most often we don't think about telephone poles in our neighborhood when we're out, but if you run or jog or quickly walk from one telephone pole to the other and then recover to the next telephone pole, that's a practical way of introducing high intensity interval training into your daily routine.
Oh, that's excellent. I'm keeping that in mind for my next run around the neighborhood.
Yeah.
So the next thing we have here is that there's growing evidence and focus on advancing research and treatment options that pay attention separately and equally to address sex differences with respect to cardiovascular disease management and care. What type of example exists in the cardiac prevention and rehab field that can demonstrate the importance of sex differences to achieve desired outcomes?
So for decades, cardiovascular rehabilitation has predominantly included men versus women, and that would be typical for many fields of research. We typically see 30 to 40% lower participation rates in women than men when we look at cardiac rehabilitation enrollment and participation. And Dr. Sherry Grace, who's a professor at York University and also a senior scientist at the Toronto Rehabilitation Institute, has been prolific in publishing on sex differences in cardiovascular rehabilitation access, enrollment, and participation. So when we really start to look at the findings, we can quickly see that these findings, which have predominantly included men, are being applied to men appropriately, but also women. And so we're taking findings that are generalizable mostly to men, but expecting them to have similar benefits for men and women. So examining sex differences in cardiac rehabilitation, and again, this really applies to most fields, if not all fields, we really need to ensure we have appropriately powered sex and gender trials so that the findings are reflective of those who are participating in these studies and for general population uptake. So my group has been specifically focusing on this area for quite a few years. And one of my senior postdoctoral fellows, or my senior postdoctoral fellow, who is probably well known to the Institute and beyond, is Dr. Tasuku Terada. And he published a few years ago an original research letter in the European Journal of Preventive Cardiology. It was a retrospective study comparing men and women who participated in high-intensity interval training, which we'll call HIIT, versus moderate intensity continuous exercise training, which is a bit of a mouthful, so we call it MICE or MIT. So HIIT versus MICE or HIIT versus MIT, whichever you'd like to use. But he showed a sex by exercise modality difference, which was statistically significant and also clinically significant in that women benefited to a greater extent by means of reducing anxiety if they participated in HIIT. But men improved their anxiety severity to a greater extent if they participated in MICE. So you can see this sex by exercise modality difference. And again, it really speaks to providing one exercise training program may not be the best approach for both men and women. And it just highlights, again, the need for this work. This is one of many, many studies that have focused on sex differences within the cardiac rehabilitation world. And we've recently just finished two studies. One is an original research study led by my PhD student, Saul Vidal, who you likely know quite well. And another is a large systematic review completed by Dr. Kimberly Way, who's a former postdoctoral fellow of mine. She pulled published and unpublished data from across the globe on differences in VO2 changes in men and women participating in interval training programs. So we have both this original data being led by Saul and this large systematic review being led by Kim that we hope to have out in the next few months. But it's really a push to look at the response of men versus women in regards to interval training and cardiovascular rehabilitation exercise training programs.
This is really exciting because in a way, this is bringing precision medicine research into the exercise science field and to look at and to focus on the differences between the sexes and genders when it comes to, maximizing and optimizing the outcomes at the end. This is extremely valuable information to have. Of course, as we all know at the Heart Institute, worldwide statistics tell us that cardiovascular disease is the #1 cause of mortality globally, and that's quite unfortunate. What areas of research in your field would you identify to be of high interest to the future contribution of the clinical and therapeutic treatments with regards to cardiovascular disease?
That's a really tough question. There are so many areas that we really need to focus on, given it's the #1 killer of women over the age of 55 and the #1 killer of most adults. So if I had to give you my answer today, I would say in terms of cardiac rehabilitation, I think there needs to be a greater push for virtual programming and the evaluation of virtual programming, especially with COVID and other potential future pandemics. We really need to equip patients with the tools to be able to exercise in their home environment or in their communities. The other is not only looking at specific exercise training, purposeful exercise training. So if you think of it, we all have 1,440 minutes a day. We have no less or no more. Everyone has the same amount. And if you engage in physical activity every day, purposeful physical activity or purposeful exercise, let's say 30 minutes, that's less than 3% of your day dedicated to exercise. It's a very small proportion. So I think we really need to go beyond looking at this 3% and really trying to maximize physical activity throughout the day to achieve greater health benefits. And there's been growing evidence showing that some is better than none and more is better than some when it comes to physical activity. So any continuous time in physical activity will lead to health benefits. And the new Canadian physical activity guidelines are about to be launched in a few weeks, and they are really focusing on the full 24-hour spectrum: sleep, sedentary behavior, physical activity, and purposeful exercise. So we still want to encourage the purposeful exercise every day, given the benefits of higher intensity exercise with cardiovascular and other health parameters. But we also want to ensure that we are minimizing our sedentary time and maximizing or ensuring adequate sleep. So research directed in this area, looking across the spectrum, I think is a really important future area of research. And that does tie in quite well to HIPAA, which is high intensity incidental physical activity. You may have heard of exercise snacks, and if not, now you have. And this was a term that was coined by McMaster University. Dr. Marty Gabala has done quite a bit of work in this area, but short bursts of high intensity activity throughout the day, incidental physical activity throughout the day. And there are others that are clearly involved in this area of work, but we really need to be encouraging and promoting physical activity throughout the day, taking stairs and maybe running those stairs, or just trying to incorporate a bit higher intensity throughout the day to really maximize those health benefits that we all need. And if we think of it from a big scale picture, less than 15% of Canadians are meeting the current physical activity guidelines. So at least 85% of Canadians can incorporate more physical activity into their day. And I would say all Canadians, 100%, can incorporate more physical activity into their day. So to summarize, I would say virtual programming, women's heart health. If that didn't come across from my previous answers, I will make sure to comment on it here again. So virtual programming, women's heart health, and evaluating movement across the full day, the 24-hour movement spectrum.
Yeah, as you just mentioned there, quite eloquently there, Dr. Reed, there are so many different areas that need to be optimized and need to be evaluated to try to achieve better overall health, and that's of course what's going to lead to a reduction in the worldwide burden of having cardiovascular disease, and looking forward to seeing what the new Canadian guidelines are that you mentioned will be coming in the next few weeks. It'll be an important document to know and to reference. So our last question for the day is mentorship and extremely valuable in shaping direction of individuals. And considering this is an early career scientist sort of initiative that we have here at BEaTS Research Radio, I always like to ask, what type of advice or words of wisdom would you like to share with early career scientists and students and trainees?
Asking a lot of good but tough questions today, which I guess you have to expect. But so I actually wrote a Twitter thread a few months ago, blog post on self-care in academia. And I'm probably going to misquote myself, but I'll attempt to repeat it. And it went something along the lines of, I used to think I needed to be the hare, at least at the beginning. But now I see you and hear you, tortoise. And if you think of the tortoise and the hare, that's what it's alluding to, in that we forget that, or maybe we don't forget, but we need to remember that academia is a marathon and not a sprint. And I think there can be a lot of early burnout in early career scientists. And I truly feel that if we simply do our best work every day, the best quality of work that we can do, the citations and the opportunities will find us. And we have to remember that this is a career that's going to last decades, and we need to be there for the long haul. So I from time to time remember the story of the tortoise and the hare, and think that directly applies to academia and those starting out, but also those at midpoint as well, that you're midway through and you've done so much to get to where you are, but there's so much that remains to be done with research programs and mentorship of those coming up through the ranks. So I pass that quote along to those listening. And the other, I would say, is directly related to the term mentorship. mentorship in general is so very important no matter what stage you're at, early, mid, and even senior career. I think there's really an importance there. But what I find is it can create a bit of undue stress and anxiety around finding your mentor. And I can remember early on being part of this program where we were supposed to set up mentors that were external to the institute in a different division in another university, and writing this email, almost this pleading email, asking for this individual to be my mentor in a specific area, and it just felt a bit contrived. And so I think mentorship will also find you, and you need to be open to both mentorship within and with outside of academia. I think you can pull the pieces that you need from so many different people. And I think that's what I've done over the years is from my colleagues to my students to friends in other industries, you kind of figure out who can provide a bit of direction in the area you need. So I would say be a bit more open about the term mentorship, and don't think that if you don't have a mentor per se that it means that you're not destined for greatness, because I don't think that's the case at all. And I guess I'll add another point in that my favorite mentorship opportunities were tea time. So my postdoctoral fellow and a colleague who I've greatly enjoyed working with for years and years is Dr. Andrew Pipe. And he used to find me almost every Monday and or Tuesday for tea time. And we would go down to Tim Hortons and sit and have a chat. And I learned more from those tea time conversations than any, scheduled meeting that we had set up. And I think it just speaks to being a bit more relaxed and listening to one another when you're making the time for someone. And if you find someone knocking down your door for tea time, don't let those thoughts of, oh, I'm too busy, I don't have time right now to do tea. Those will be some of the best moments, at least they've been some of the best moments of my career today in terms of helping to shape the direction and focus and opportunities.
These are excellent and extremely valuable points that you shared with us here, Dr. Reed. The slow and steady wins the race mentality, as well as thinking of mentorship moments as opposed to just mentors, but like the different ways in which one can get mentorship from multiple sources is definitely quite important for early career folks to keep in mind and look for and value. This concludes our interview. Once again, I'd like to thank our guest today, Dr. Jennifer Reed, for the informative and fascinating talk with us regarding the advancement of exercise physiology and cardiovascular health. On behalf of our director, Dr. Emilio Alarcon, our regular radio crew of Holly Arnett, Alex Ross, and myself, thank you for tuning in. Don't forget to subscribe to our YouTube channel and podcast, and we'll see you again soon with another Science for the Community episode. Until next time, be everyday safe and heart healthy.